Hey guys, it is Mrs. Page, and this is the highly anticipated SimChart review that we will be going over today. I have this set up to where it's going to look like what you guys will look like. So I have it as viewing as a student. So this is what it should look like at the very beginning. This will be your content home, and then you'll click down here on My Clinicals. And then you'll select the week, whichever week we are on. So I'm just going to randomly select week 5. And then it's going to have you do the click to access simulation and then open this pop-up blocker. So this is what you will see at the very beginning. You're going to have to fill out all of this information. So I went ahead and filled all of this out, and make sure again that you fill all of this out. Or if you leave anything blank, it's not going to let you save. So you'll go ahead and push save. We'll say save successful, and then it's going to pull you up to this page. I like to go ahead and start up at the top and work my way down. So this automatically pulls you down to this preclinical manager. Now we will use this, but I like to go ahead and start back up at the top. So I'm going to go to patient charting, then system assessment. And this is where you can do your complete physical head to toe. So you'll click on this and drop down. You'll want to plug in everything here. General, integumentary, so skin, head and neck, ears, nose, throat, eyes, vision, respiratory, cardiovascular, peripheral vascular, lymphatic, breasts, abdomen, musculoskeletal, neurologic. You will pick one, female or male. So if you have a male, then you'll just put NA in female and fill out the male and vice versa. Rectal, more than likely you guys are not going to assess this, but if for some reason you need to change your patient and you notice that they have some external hemorrhoids, then you can go ahead and put that in this rectal area. Other here. And you don't have to fill out this assessment summary or plan. After your head to toe, you can go ahead and scroll down, and we're going to fill out the pain assessment. So you click on that. You fill out all of this information. Do you have pain now? Yes or no? Location of the pain, frequency, intensity. If you use the FACE scale, you can use this. Nonverbal cues, physiologic cues of pain, the quality of pain, aggravating factors, relieving factors, and then you can fill out your pain interventions. You'll click on this, and it'll pop down any kind of, or these interventions that you could complete. If you want to make any extra notes here, you can do the pain care notes here. After the pain assessment, we'll scroll down to safety assessment. You shouldn't ever click this because you should always assess the safety of your patient. So, are they oriented to time, person, place, or do they have limited orientation? You want to fill out this Morse fall risk. This is going to tell if they're at a risk for falling. After you click, or after you fill all of this out, a number will automatically pop up here, and it will tell you what kind of risk they are for fall. If restraints are being used, you'll check that. And then make sure to see if they have their hospital ID, allergy bracelet, fall risk, blood bank, or if they have other. For example, if you check other in the bracelet check, maybe it is a limited extremity, so you can't have blood pressures in the left arm. You would want to chart that right here in the safety notes. After safety, you'll do special precautions or isolation. You will want to check for, everyone should be on standard precautions, so standard precautions in effect, hand washing, all of these. If they're in respiratory precautions, contact precautions, or droplet, you'll want to check depending on which one they are on. After you finish all of these system assessments, you'll go ahead and press save down here. This one says no changes are made to save, and that's because I didn't chart anything, but it should pop up here and say save successful. After you've completed everything in the system assessments, you'll go down to special charts. Click on here. It says your data has not yet been saved. Do you want to save changes? You can press yes. And again, it says no changes are made to be saved, and that's because I didn't chart anything. I'm going to just press no. Special charts, and then we're going to go to our miscellaneous nursing notes. So this is where you do your every 2-hour nurse's notes. You can go ahead and make a initial nurse's note. So when you go into the patient's room, so let's say at 08:30, you completed head to toe assessment. Patient is lying in bed, call light within reach, overbed table within reach, side rails up, no complaints at this time. So that is, and then you'll put a page SN for student nurse. So that's going to be your initial entry. So that's kind of essentially like when you were on your nurse's note page, you were writing out your entire head to toe. So since we're putting that in the head to toe system assessment here, you won't have to type out your entire head to toe. You'll just make a note when you were first in there so we know what time. And then your miscellaneous nurse's notes, you can say at 10:30, vital sign check completed. You can enter the vital signs here. No complaints at this time. So, yada, yada, yada. You guys know how to do nurse's notes every 2 hours. So it's the same thing as your 2-hour nurse's notes. You just chart it in here. I'm going to press cancel because I'm not going to save it. Okay. So after that, we will go down to wounds. If your patient has a wound, then you will fill it out. You'll click on where it is. Say he's got it in the sacrum. You'll fill everything out here. Let's say that it was a pressure injury. And we'll say it was a stage 3. You can do length, width, depth. And then just fill this information out and then press save. Make sure that you're saving after all of these. If your patient doesn't have a wound, and I'm going to cancel this because I'm not going to save it. If your patient doesn't have one, then you're not going to fill out the wounds section. IVs, same thing. You're going to click on where the IV is and fill out all of the information that pops up. So, peripheral. Insertion time, you'll only do this if you are the one that's inserting it or if you saw the nurse inserting it. Over the needle, 20 gauge, number of insertion attempts. Again, you're only going to do this if you know how many times it took them to insert the IV. Insertion site clean and dry. No redness or swelling noted. Dressing clean and dry. Patent flushes easily if you have flushed it. Or let's say that sometimes you'll have those in the right AC or left AC and they're difficult to flush and the IV is positional, so maybe you have to have the patient straighten their arm out. So you can check that. No complaints at this time. If they're using an infusion pump, you can select that here, and then maybe you need to say normal saline at 100 mLs per hour infusing. And then save. Make sure, again, up here the save is successful. Drains, tubes. Let's say they got a right near NG tube. So you'll fill all of this out depending on your patient. I'm going to cancel this because I don't want to save it. Ostomies, same thing. You're just going to click on it. Where is it at? Fill the rest of it out. After you get your patient charting done over here, you are going to go down to vital signs. You're going to click on vital signs first. You're going to put all of this in. Everything should be filled out. Temperature, pulse, respiration, blood pressure, oxygen. Then you will save it. And if you need, again, in your 2-hour vital sign check, if you need to go back in and put in some new vitals, you're going to do the same thing. You'll go here and do vital signs and save it as well. Intake and output, if your patient is on eyes and O's, You can put how much intake, depending on PO fluids, ice chips, miscellaneous, if they had some tube feedings, meals, and then output. You can make any kind of notes down here if you need. Height and weight. You can either do feet and inches or centimeters, and then you can do weight, pounds and ounces, or kilograms and grams. Blood glucose, if it's applicable. If your patient doesn't get their blood sugar checked, then obviously you're not going to fill this out. But you will put this in here. Let's say less than an hour. Glucose was 245. And then it'll say nursing actions. So did you give insulin per order? Did you monitor the patient or notify provider of blood glucose levels? More than likely, you're going to give insulin because of this. And then you'll save. Say save successful. After you finish everything here on vital signs, you'll go down to patient data. Down here. We're going to do allergies. We're going to enter their allergies. So add an allergy. Let's say it's a medication and they are allergic to penicillin. Let's just do we can just type in penicillin and see. Penicillin, let's say that they have some itching and it's mild and the patient informed you and they are reliable. You can save that here and I'll type in penicillin. Okay, easy. Health history update. This is where you're going to put in their health history and their surgical history. You can fill out, if for some reason you can't find the health history in this list, you can type it in right here. If they have any anesthesia problems, you can type it in here. And again, if you can't find any of the surgeries, type it in here. You don't have to fill out this diabetes history, and you don't have to fill out this recent fever requiring antibiotics. After your health history, you're going to go down to preclinical manager, and you're going to go to medications. So this is where you're going to enter your medications. All medicines that the patient is prescribed should be entered, and if you give any PRN medications, those should also be entered. So we're going to select a medicine. Let's say we gave... So let's say this patient is getting potassium chloride IV. Potassium. We can type in potassium chloride and then select the correct one. Make sure that you're selecting the correct one because you're not going to give the oral solution IV. So make sure potassium chloride injection. Then this pops up. It says about potassium chloride injection. You can click on this and it pops up with the clinical pharmacology. So we can go ahead and type in here potassium chloride. This is going to give you all of the information that you need to know on this medication. So let's go to description/classification. We're going to go back here. Classification. And you're like, oh man, I don't know what kind of classification potassium chloride is. Go over here, read, and it is a mineral supplement or alkalinizing agents. We'll just do mineral supplements. So we can type in here, mineral. And you can type in, it doesn't have to be the drop down arrow. Route, again, we're going to give IV. But you want to know if it's IV infusion, IV piggyback, or IV push. So we're going to say that it was an IV piggyback because after that we're going to give normal saline. Or no, actually we're going to do an IV infusion because we are concurrently going to give normal saline with the IV as well. Dose will say 20 milliequivalents. Frequency will say daily. And the date that's ordered. So when did it start? If it started today, then you can click on here. Under all of these, so you'll fill out comments. And comments and additional medication information, I want you guys to put in here why your patient is taking this medicine. So this patient hypothetically is taking this potassium IV because their potassium levels are low. So potassium level 2.5. Need IV potassium replacement. So again, comments. This is going to be, why is my patient taking this medication? Okay. Then the next thing you're going to fill out is the side effects. I'll go ahead and put 3 in here. So one side effect would be hyperkalemia, burning at infusion site. And let's say you don't know what a third side effect is off the top of your head. So you can go over here, go to adverse reactions, and look, warning signs to watch for include ECG changes, cardiac arrhythmias. So a side effect can also be cardiac arrhythmias. Then you're going to go to and fill out nursing interventions. So what are you going to do while your patient is giving this or getting this medication? So you want to monitor for cardiac arrhythmias because they can be fatal. You want to monitor lab values, specifically potassium levels. And I do not want you guys to just say monitor lab values. I want you to put in there specifically potassium levels, because if you say monitor lab values, that's not going to tell me anything. I need you guys to know what lab values that you are going to monitor. And then the IV route, you want to monitor IV or infusion site for redness, swelling, burning, or pain. Okay? So you're going to fill all of this for your medications. Again, as a review, you're going to fill all of this top part out. Under comments and additional medication information, you're going to say why your patient is taking this medication. You're going to give 3 side effects or adverse reactions and 3 nursing interventions. Then you will press save, and you can see that your medication is added. After you have completed everything in your SimChart, and I mean everything, you will want to go up here and you will press this submit button. Please make sure that after you have completed everything, you submit this, because it's going to show us that you're still working on it. So if you don't submit it, then we're going to say that you didn't submit your work on time. So then you'll get demerits for that. So make sure that you hit submit, and it says, are you sure you want to submit? Once submitted, no further changes can be made. You will lose any unsaved work, and then you press submit. One thing that I do want to point out is up here, documenting in current date and time. So you can change this, the date and the time. So specifically when you're doing under your patient charting and you're doing your nurse's notes, we know that, see, this is saying 11:36. So we could go in here and say change date and time. So let's say that you checked on your patient at 10:30. So you can change that time and then chart here. Let's just say chart something, blah, blah, blah. Save. And show this save charting. So it's going to change your time up here. So that's another way that you guys can make sure you're charting under the right times. All right, and then again, submit. Your assignment has been submitted for grading, and there is no further action required. You may close this browser. And that is all for your SimChart. If you guys have any questions, please reach out to your clinical instructor, or you can reach out to me. But this should be pretty comprehensive on exactly what you guys need to be charting on SimChart. So hopefully there won't be any kind of confusion.